Okay, so now we're going to talk about the appendicular skeleton, and this is also referred to as the pectoral girdle. I'm sorry, we're going to talk about the axial skeleton, and the first part we're going to talk about is the pectoral girdle. This is also referred to as the shoulder joint or shoulder girdle. This will connect the upper limbs to the trunk. It consists of the clavicle and the scapula. Both bones are extremely important in muscle attachment sites. This is very important for this particular joint, is that this joint is held in place by a lot of muscles. So the clavicle is an S-shaped bone. It articulates with the manubrium of the sternum, and that will actually, at the sternal end, and it will articulate with the acromion of the scapula, which we'll see in a second, at the acromial end. So this portion here, the medial end of the clavicle, will articulate with the sternum. The acromial end of the clavicle will articulate with the scapula. We can see that right here. This is your breastbone here. This is the medial end, the sternal end. Here's your scapula or your shoulder blade, and this is the acromial end. So the scapula is a triangular bone. And here you can see an anterior view, posterior view, and a lateral view. Lateral view is looking side. And one of the things that the scapula will have is what we call the glenoid cavity. And the glenoid cavity is where the head of the humerus, which is your forearm, will fit into. So the key bone markings for the scapula, we have the glenoid cavity or glenoid fossa. This articulates with the humerus to form the shoulder joint. The other one I want to point out in this slide here is the acromion. This is the larger posterior process that's going to articulate with the distal end of the clavicle that we just talked about. So looking at the upper limb, the arm, the brachium, this is going to be referred to as the humerus. It extends from the scapula to the elbow. The forearm will be the radius and the ulnar. And then you'll have your wrist and hand. This is made up of the carpal, metacarpal, and phalanges. So let's look at these. So this is the ulnar, I'm sorry, the humerus right here. Okay, this is the head of the humerus. This is what's going to fit into the shoulder joint. And at this end here is we'll have the radius and ulnar articulating to form the elbow joint. So the radius and the ulnar, the radius is on the lateral side of the forearm, while the ulnar is on the medial side. Again, this is an anatomical position. So in anatomical position, your thumbs are pointing outward. Key bone markings on the ulnar. We have the olecranon. This is the point of the elbow joint. The trochlear notch articulates with the trochlea of the humerus. The radial tuberosity will articulate with the radius. And then the shaft ends distally with a short styloid process. And if we look here, we can see the ulnar, okay? And here's the styloid process right there. Here we can see the trochlear notch. And then this is also the olecranon here, okay? So this is actually, again, as we mentioned, that's the point. If you were to bend your elbow, this is what you're feeling right in that joint right there. The importance of this is that this process that's sticking out like this prevents your arm from opening greater than 180 degrees. Or overextending the arm, essentially. The radius and ulnar are actually connected to each other, and there is an interosseous membrane that connects the ulnar and the radius along the length of the bones. And some markings of the radius is we have a flat radial head that articulates with the capitulum of the humerus at the radial notch. The radial tuberosity will articulate with the ulnar. And there's also a distal styloid process of the radius that will articulate with the carpal bones. So let's talk about the carpal bones. These are your wrist bones. There are 8 of them. And we have our proximal row, which is the one that's closest to the radius and ulnar. This would be the scaphoid, lunae, triquetrum, and pisiform. And the distal row, which would be the second row, closest to the fingers or phalanges. This would be the trapezium, trapezoid, capitate, and hamate bones. In the hand, we'll have 5 metacarpal bones. They form the palm of the hand, and they articulate with the phalanges or finger bones. Each hand will contain 14 phalangeal bones, a proximal, middle, and distal in each finger, and a proximal and distal in the thumb, or the pollex. And if we go back to that picture, these are our metacarpals, 1, 2, 3, 4, and 5. And then these are your phalanges. This would be proximal, middle, distal. And in the thumb, you have proximal and distal. And there's 14 phalanges or phalanxes. Okay, so the pelvic girdle, this is going to articulate with the femur, thigh bones. More massive than the pectoral girdle. It firmly attaches to the axial skeleton. It consists of 2 irregularly shaped large hip bones, or coxal bones. Each coxal bone is formed by the fusion of 3 bones, the ilium, ischium, and pubis. And the fusion of 3 bones is usually complete by the age of 17. So this would be a coxal or hip bone right here. And here we can see this is the ilium portion, here's the ischium, and then here's the pubis. And it's actually the pubis bone that will articulate with the other pubis bone, forming what we call the pubic symphysis. And this is the point of attachment between the 2 hip bones. Each hip bone will also articulate with the sacrum. So the ilium is the superior and largest component of the hip. The ischium has a rough projection called the ischial tuberosity. This particular tuberosity supports the body's weight when sitting. The ischium and pubis fuse, creating a circle called the obturator foramen. This will allow the sciatic nerve to pass through. And then the pubic bones are joined at the pubic symphysis. The hip bones, the sacrum, and the coccyx will form what we refer to as the pelvis. There are differences between the male and female pelvises. Females are smoother and have less prominent markings. They are also adapted for childbearing with broad, low pelvis, larger pelvic outlet, and a broader pubic angle. Now the lower limb, this is going to be composed of the thigh, which is our femur, the patella or kneecap, the bones of the leg, which are the tibia and fibula, and then the bones of the ankle and foot, which would be the tarsal bones. There are 7 of those, 5 metatarsals, and 14 phalanges in each foot. So here's the femur. And then on the right-hand side here, we can see the tibia, which is the larger of the 2 bones, and the fibula. I want to make a note that the fibula is not a weight-bearing bone. All the weight is actually transmitted down the tibia. So the femur is the longest and heaviest bone in the body. Key bone markings: the head articulates with the pelvis at the acetabulum. We have the greater and lesser trochanters. These are large, rough projections extending laterally from the neck and shaft. And then you also have the lateral and medial condyles, which will articulate with the tibia. The patella or kneecap glides over the anterior surface between the lateral and medial condyles of the femur, within the tendon of the quadriceps femoris and the patellar ligament. Irregular shaped bone, sometimes called a sesamoid bone because it looks like a sesame seed. The tibia, this is a large medial shin bone. And key markings here, you'll have your condyles, which will articulate with the femur. The patellar ligament, which will connect the patella and the tibial tuberosity. That's actually the rough spot just below the knee joint. And the medial malleolus, which is a large distal process that's going to articulate with the ankle. The fibula, this is a slender bone. It's not for weight bearing. It runs parallel and lateral to the tibia. does not articulate with the femur, and the lateral malleolus bone marking is the distal end of the fibula. And like we saw with the radius and ulnar, the tibia and fibula are actually connected with each other by what's called an interosseous membrane. Okay, so looking at the ankle, there are 7 ankle bones, which are referred to as tarsal bones: the talus, calcaneus, navicular, cuboidal, medial, and lateral, and the intermediate cuneiforms. Only the talus will articulate with the tibia and the fibula. The largest tarsal bone is the calcaneus, or your heel bone. And much like we saw with the hand, with the metacarpals, in the foot we have the metatarsals, and there's 5 of those. We also will have the phalanges, which will make up each of the, let me see, yep, 14 phalanges in each foot as well. Okay. And then the only exception would be the phalange, much like we saw with the thumb. The hallux, which is your big toe, only has 2 phalanxes. Okay. So let's look at the arches of the foot. You have the longitudinal arch and the transverse arch, as you can see here. The purpose of these arches is they actually help to transfer weight along the foot. So if you realize your foot is not flat, it's actually arched. And this is helped and maintained by ligaments and tendons. Now, sometimes if there's pressure that's put on these ligaments and tendons, that can actually cause a lot of pain, and that can lead to various issues with the feet. All right, so now we're going to just spend a few minutes talking about joints and articulations. Joints are going to be classified on structure. They could either be fibrous, made of cartilage, which would have both limited movement, or synovial fluid, which would give you freely movable. And then they can also be classified on their function. Are the joints synarthrosis, which means they're immovable; amphiarthrosis, which means they're slightly movable; or diarthrosis, which means they are completely movable. And this is just a table that summarizes the different structural and functional classifications of joints. So immovable joints, or synarthroses, these are classified as either fibrous or, more common, made up of cartilage. And these would include things like sutures, which connect skull bones; thumphosis, which is a ligament binding each tooth into the socket; or syndesmosis, which is a fibrous joint connected by a ligament that attaches the tibia to the fibula and the radius to the ulna. They could either be classified as fibrous or made up of cartilage. Synchondrosis, this is a hyaline cartilage connection, as in between the first pair of the ribs and the sternum. Symphysis, this is a joint between bones separated by fiber cartilage. This is something that we see within the pubic symphysis, that connection point between the 2 hip joints we just talked about, as well as in between each of the intervertebral discs. With the symphysis, these joints are meant to withstand a lot of pressure. And if you think about your vertebrae, you're putting a lot of weight on that spine, and in between those bones, each of the vertebrae, you have this type of joint there. Freely movable joints, synovial joints are the most common. They have a wide range of motion. It ends of bones covered with the articular cartilages, and then this will be surrounded by a fibrous joint capsule. And then in between, there's a synovial fluid, which reduces the friction, lubricates the surfaces, and nourishes the cartilage. As you can see here, we have that space, and the space is filled with fluid. Additional padding, menisci in the knee and shoulder, fat pads, bursa, are packets of connective tissue containing synovial fluid. Sometimes if you have a bursa or becomes inflamed, that's referred to as bursitis. And that can happen, say, in your shoulder joint or some other joints. And ligaments will join bones to bones. Different types of movements with joints. We have plane or gliding movements. These are two opposing surfaces will slide past each other between the carpal bones. So if you take your wrist and kind of move it left to right, that would be a gliding movement. Angular movements include flexion and extension. This is decreasing or increasing the angle between the articulating bones. Hyperextension is extension beyond an anatomical position. For example, if you were to extend your elbow joint beyond that 180-degree mark there. Abduction and adduction. Abduction is moving a limb away from, or adduction is moving it towards the midline of the body. Circumduction moves the limbs in a 360-degree circle, like drawing a circle with your leg. You also have rotations. We have pronation and supination. Pronation is moving the palm from facing front to facing back, and supination is moving the palm from facing back to facing front, as you can see in the image right here. We also have an inversion and eversion. This twists the sole of the foot either inward or outward. Dorsiflexion or plantar flexion. This elevates the sole, such as lifting your toes up or pointing your toes downward, such as on your tippy toes. That's plantar flexion. Elevation and depression. This moves a structure superiorly and inferiorly. And then lateral flexion. This is the vertebral column bending from one side to the next. So if you were to sort of bend one side or the other. Okay. Let's see if I have some pictures of these. Oops. Sorry. So types of synovial joints, we have gliding joints. These have slight movements. Mostly bone surfaces slide across each other, so movement is slight. You have hinge joints. These permit angular movements in one plane. It's like opening and closing a door. Saddle joints. These permit angular movements in two planes. This would be, for example, the carpal metacarpal joint of the thumb and the joint between the sternum and the clavicle. And then a pivot joint. This permits rotation only in one plane, such as the ulnar and radius joints. We have some joints that are referred to as condylar joints. This is where two bones sort of fit into each other and they can glide or rotate. Ball and socket, this is like what we see with the head of the femur or the head of the humerus fitting into those sort of capsules where they sort of fit in, and it's a rounded projection. This actually, the ball and socket allows for a lot more rotation. Okay, so let's look at some different types of joints. Here we can see the intervertebral joints. This would be that cartilage that's found in between each of these vertebrae. So you have this nice cartilage, fiber cartilage between each of the vertebrae forming these joints. The shoulder joint, this has the greatest range of motion, most frequently dislocated. Stability is sacrificed for mobility. It is a ball and socket joint, and it contains several bursa to reduce friction. And muscles that surround and move the shoulder joint will form what we call the rotator cuff. The elbow joint consists of two parts, a hinge joint between the humerus and the ulnar. It's a weak joint between the humerus and the ulnar. And then the hinge portion is usually very stable. The humerus and ulnar interlock, very thick joint capsule. The joint capsule reinforced by strong ligaments. The hip joint, ball and socket joint, that's formed from the head of the femur and the acetabulum of that's the carved out region formed by the hip joint there. I'm sorry, the coxal bone. And can you see if I picture this? Yeah, right here. So here we can see the head of the femur, and it sort of fits into that hip bone right here. Knee joints. 3 different joints make up the knee. You have a hinge joint between the femur and the tibia, a plane joint between the patella and the femur, and 2 joints between the femur and the tibia. Medial to the medial condyles and lateral to the lateral condyles on both bones. The medial and lateral menisci. This is fibrocartilage pads between the femoral and tibial condyles. This will help to cushion and conform to the changing shape with the femoral movements. And here we can see that knee joint. And one thing I will just mention is that the knee joint has a lot of ligaments that hold that structure in place. That's what all these white structures are here. These are the ligaments, but you can see all of these ligaments really holding that knee joint in place there. And again, just think about that joint. You have a lot of pressure that's being put on, a lot of weight that's being put on that particular joint. So it's a balance between bone formation and recycling, involves interactions with other systems. Bone provides attachment sites for muscles. Bones are extensively interconnected with the cardiovascular and lymphatic systems. Physiologically, bones are under the control of the endocrine system. And then the digestive and urinary systems will provide calcium and phosphate for bone growth. That is the final recording for chapter 6.